Hi everyone, this is a final report video presentation, and my name is Grace. I'm from Benin, currently living in the Marinades, and our community we will be working with is Worcester community, and it has a population of 52,000 people with 52% of male and 48% of female. The median age is 50.6. How cardiovascular disease impact our community? It causes a lot of death in that community. It reduces the quality of life for the population, and the number of disability is increasing. What we call a modifiable factor is the risk factor that can be changed or controlled. So in our community, we have identified smoking, obesity, physical inactivity, alcoholism, like the most important risk factor for cardiovascular disease in our community. For our intervention, we will be addressing obesity due to physical inactivity as a risk factor, and we will be using social cognitive theory. What we call theory is what we use in program planning to understand and explain health behavior and to guide our development and implementation of intervention. Socio-cognitive theory started like social learning theory in 1960 by Albert Bandura, and it in around 1986 we call it social cognitive theory. It posits that learning occurs in social context with active and reciprocal interaction of a person, environment, and behavior. We have 5 construction. That theory has 5 construction, but we will be addressing around 3 or 4 of those construction, principally observation learning, where we will be using a modeling method. Is when a person observe a behavior conducted by others and then reproduces the same action. Our objective in that case is demonstrating to cardiovascular participant that taking a stay at work or home setting every day is an effective way to be active, or demonstrate to cardiovascular patient that the effective way to engage in physical activity every day in home setting through video and social media. The other ones is self-efficacy is where the person has the ability to perform the behavior successfully. The third one we have developed is the outcome expectation, where participants should expect that every day a physical activity at home or at work will lower the risk of cardiovascular disease. So the most essential important I want to talk about is social structural factors. Our objective in our intervention case is to provide a gym setting every day at work for workers and provide 1 hour of break every day at work to employees so they can work out. So based on this, we must work with policies makers which will advocate for those objectives to be realized on all of those work setting. By doing this, we should meet our initial goal, which is reduce cardiovascular disease by incrementing physical activity. As I said earlier, the method we will be using is a modeling and the facilitation, the most important. And modeling is providing a model to reinforce the desired action on that person. And the facilitation is when we identify barrier facilitators and the empower for making the appropriate change. In conclusion, Worcester County, Maryland, and has a diverse population highly impacted by cardiovascular disease. Among the risk factors identified, obesity is the most important. Our goal is to reduce cardiovascular disease in that community by using social cognitive theory. By accomplishing each construction objective we talk about, our initial goal will be achieved. Most relevant methods are modeling and facilitation. And thank you. See you soon and have a nice day. Bye.